So as I said, I'm Supriya Bezbaruah, and we've all been, trying our best with the infodemic management. We're in the WHO Southeast Asia region. I think by now you're all familiar with the different regions. Southeast Asia region, this I've literally taken a screenshot from our dashboard of the COVID response rate. We have 11 countries that in Southeast Asia: India, Nepal, Sri Lanka, Maldives, Bangladesh, Bhutan, Myanmar, Thailand, Indonesia, Timor-Leste, and DPRK. And these are, of course, the number of cases, and that tells you just how badly we've been affected by COVID. And if we looked at the infodemic, they're also pretty big. But we started thinking about infodemics actually last year when we had a risk communication strategy. And as part of the risk communication strategy, we had listening and development of communication intelligence and plan for rumor management, including social media. The reason is we had several outbreaks, as there have been in other parts of the world. And we noticed that every time there was an outbreak, there was an infodemic as well as with an epidemic. And this was supported in our regional committee meeting by all ministers of health. So it was part of our regional committee meeting and approved so that we take this forward in the region. But that was in September 2019. And as you know, soon, only a few months later, we had COVID. So this was what we planned last year. Member states have an effective plan for monitoring, analyzing, responding to rumors and fake news, and WHO to provide support. And we had COVID was, of course, we had the infodemic and we were in response mode, but it sort of pushed us all, and it was a great opportunity in a sense to find out how well we can manage an infodemic. So we dive straight in, and we had 4 ways to do the infodemic management. Of course, digital listening and responding through digital media. So we do 2 things. We do public insight as to headquarters and Tina's and EpiWin team and many other countries as well. And then we also monitor rumors and misinformation in 10 countries in 10 languages. And we've been doing that since mid-February, early March. We've also partnered with fact checkers who provide us with rumors, because a lot of it we cannot track as easily because they're in WhatsApp or encrypted social media, whereas what we track in rumors and information is all through open media. And a lot of it is going on in WhatsApp. India, in fact, has the largest number of WhatsApp users in the world. And they're very, very active with rumors and misinformation. So that's how we try and tap into that. Of course, to listen, to find out what people are thinking, we have perception surveys. And fourthly, we try and use influencers at the country level, especially. And if you listen to, we had Sahani talking to us from the Sri Lanka experience, and she also explained how they use influencers and community health workers for feedback and also to respond to rumors. We did 3 ways to manage the infodemic: identify, analyze, and address. When we analyze, we verify, categorize, check the influence of the people spreading rumors and the engagement. And we look at amplifying facts through credible sources. We try to refute rumors with facts. We try and avoid directly refuting rumors. You don't want to get into a clash, we're right, you're wrong, that sort of thing, as you've heard the last few sessions. And for that, like many other countries, we've been using an AI tool which scans more than 50,000 conversations a day. And then AI goes only that far. You need the human touch. So we have further manual scanning to look through what the tool picks up and see, okay, which of these are real rumors, or is it just something else that the AI tool misclassified? We check the tone, the sentiment, the fake news, as well as rumors, and then we classify it into behaviors, into cures, prevention, stigmas, and other buckets. So how do countries in CRO identify fake news? Of course, there's traditional media. Most of them use traditional media. All of them use digital and social media, which is not surprising because that's how all fake news is getting amplified. Hotlines are being used because a lot of the queries on hotlines are also to check on, I've heard this. Is it true? What do I do? Public perception surveys, as you've heard, feedback from health workers. Some countries do that, feedback from other sources. And then some countries have other means, such as, emailing queries to a particular email and other means. As I mentioned, we've been tracking rumors since February. And we have more than 1,000 rumors after we sort it out manually and take out all the AI have picked, which we didn't think were rumors. We find that 35% of the rumors concerned cures. And that means, you eat, I don't know, some herb and you'll be cured of COVID, or there was one about you wear a eucalyptus necklace around your eucalyptus leaf necklace around your neck and you'll be cured of COVID. I mean, there are all kinds of things. 20% concerned prevention and behaviors to prevent COVID, which were rumors. Actually, 9% of our entries actually dismissed a myth, which is good news because there are a lot of people out there actually dismissing myths as well. And what's interesting to me is that 71% of the fake news that we identified were not trending on social media, but almost 30% was, so that's concerning. That's, almost a third. So it's really big and we really need to be very, very proactive. Because in the Southeast Asia region, India has the largest population, it's one of the largest countries and one of the most active social media users. A lot of the rumors are driven, and infodemic in general on social media is driven by India. So not surprisingly, a lot of news about Ayurvedic medicine, herbal remedies were some of the most frequent subjects of rumors. But there was also, unfortunately, especially in the early days, a lot of stigma. So these are our categories by volume and engagement. As you can see, the vast majority are about cures and preventive measures. Vaccines are now creeping up. So this is the time span. This started from February to September. And it's only towards the latter part of the year that there's been more fake news on vaccines. Therefore, you see more of cures and preventive behavior. But I suspect as we analyze the latter part, we'd probably have more on vaccines. Stigma and discrimination comes in spurts. So it's relatively less. But as you can see, it's high engagement also. And then there's the rumors about that takes quite a bit of engagement, is social and economic. And then the high engagement here is also on transmission, how COVID spreads. This is, some of the peak rumors over time. What the first country in Southeast Asia to report COVID was Thailand. And so the first peak was in Thailand. And then we had Indonesia looking at claims that, and this was also part of global rumors, that hot weather conditions ensures that COVID will not spread in countries in our region, essentially, which is almost, all of them almost are tropical and hot. This is another one from Indonesia that about the testing. Then we have others. And this is just to give you an idea of how we listen. This is one example. We do this for every country in Southeast Asia. We check by country which are the largest rumors that are going around in terms of both volume and engagement, and also whether they're myth busters or myth spreaders. The reason I've chosen Indonesia is that while they're very active on social media and there are a large number of rumors, you also have a very active myth busting community there. And Epidemic's been very active, and they've also been engaged in the previous global infodemic conferences. You've probably heard Mafindo speak, you've probably heard others also speak. So that there's also more to learn from how they do it. So how do we analyze fake news? Do we need to act through all of them? We don't think so. What we look at before we act is looking at the credibility of the source, how much they've spread, whether they're trending. If you remember the first slide, we said that almost 30% of them have been trending. We also look at, is it likely to be harmful to people or likely to cause panic? And then we decide on how we react, how we address the rumor. And this is some of the ways we take action. If it's not serious, we just let it go and monitor it. If it's serious and has a global impact, we call up people like Tina and her colleagues there. If it's country specific, we inform the country. If it has an impact across the region, we address through social media, through infographics, through our fact-checking partners as well, and of course through the media. We use our website and our social media sites quite extensively. And as you see, we've had more than 1,000 fake news since March. How do they address rumors at the country level? You've seen that also in all the videos that were shared from different countries. And most of them use government social media sites and government websites, also WHO, UN partners, civil society websites, media. Then a number of them use influencers. By influencers, they're both community influencers and stars, famous people. Globally, you have the Korean pop band, as a very strong voice, of course. But I was really surprised that they also have a strong influence on Southeast Asia, including Sri Lanka. So influences come from various sources and not always what you would imagine. In India, of course, Bollywood stars are very, very influential, and they've been speaking up as well. Health volunteers at the local level, and that's very important. We saw in some of the videos from the country levels that you have to engage at the ground level with people. It's as much as you do on digital media, and health volunteers have played a very important part. And this has been documented, especially in Thailand, where they've gone up to the communities, given information, given facts, and addressed rumors, and of course, community leaders. So moving ahead, what are we going to do in Searo? We're going to establish a regional infodemic network. You've heard of what Afro has done in one of the videos. We also hope to do something similar in Searo. We'd like to strengthen infodemic management in the countries, and that's where you really play a part. Make it a systemic, make it a part of the system and systematic, and not an afterthought, but something you do automatically, just like the EPI response, once there's an outbreak. For that, we need to learn a lot more, more operational research, especially understand the common pathways through which rumors spread, understand the impact of rumors and misinformation. We've heard 30% almost of rumors have been trending. Then what's the impact? Is that affecting people? Is it stopping them wearing masks? Is it stopping them believing in COVID? Or do they think they're protected because they're wearing eucalyptus leaves around their neck? I mean, it sounds stupid, but someone might think, yes, I'm protected. So I have a cough, I have a cold, I can barely breathe, but I'm going to be okay. And that's where it starts getting worried. But most importantly, what we do, we need to monitor and evaluate both at the WHO level and at the country level. How well are we doing? Are we doing the right thing? Are we actually having an impact? So that's from me. But when you've looked at all the videos, you see that, that there's, from the country level, there's been videos from different countries, from different regions, from Peru to New Zealand, but all of them have some things in common and some that are pretty unique to the countries. So what do you think is common between countries? Have you all seen the videos?
Yeah, now we
hear me?
Yes, perfect. Welcome back.
Great. Okay, so that did it. I had to leave you to get to hear you. So thanks, Tina.
So Supriya, look, we asked the question that you were asking in class, and if you wish, I can just slowly scroll through and maybe you can comment and react to some of the comments from the colleagues.
Yeah, excellent. That'd be great. So, okay, transparency is critical, ground level, that's unique. The challenge is to gather information. MOH is doing their best to gather information. Partnerships are very good. It's still early. In some countries, it's only media monitoring and prepared press release as an intervention. Partnership trust takes months to build and is lost in 1 second. Yes, that's true. Someone says that globally we're doing good work. I agree. It's a new topic, and considering how new it is and considering how we're still learning, I think all over the world we're doing pretty well. But the common thing is lack of trust, more risk communication, partnership, and the common theme of involving communities, listening to them, understanding local cultures, absolutely. And must be done actively. Great. If you continue, Tina?
Yes.
Common lack of trust is true. Lack of trust is a problem, and that's where you have rumors going viral. Then okay. So some of you've said you haven't seen the video. Well, I encourage you to see it. They're really good, and you learn a lot about how different countries are approaching it. But even if you haven't seen the video, what is your experience? What do you think are some key issues at the country level? And also in your conversations so far and discussions, all of that. Community engagement, media monitoring and evaluation, partnership with digital community. Yep. Community engagement. Go on a bit more. Okay. So quite a few people think of community engagement, technology and social listening, influencers.
There's also a question outside of this. Someone posted a question. Are there any efforts to include or engage the youth as a part of the response?
Absolutely. I think globally, there's been quite a bit of engagement with youth with the EpiWin team at WHO. In the region, we are engaging with youth at different levels, mainly at the country level. At the regional level, we've been more generic, and we've been working more with community leaders and faith leaders in the region, have engaged them. But youth are very, very important. But a lot of
Please mute yourself.
Sorry about that, you guys. Just a quick reminder to mute, make sure your microphones are on mute. I'm trying to mute whoever that microphone is, but if you can help me make sure that we're all got our microphones on silent.
I put him into waiting room until he mutes himself. So
okay.
So
I love
Supriya,
that, Tina. Harsh.
So maybe actually, Supriya, to follow up, I'd be really curious. You know, I think the fact that you have a regional level perspective is a really unique one, because you're seeing multiple countries trying to deal with their infodemics and trying to deal with misinformation and too much information at the country level many times over. And I'm curious, how are different countries essentially being able to compare notes to one another and really learn from one another? I'm just curious to hear what your experiences have been, and because I know there's been a lot of webinars that the CRO office has been conducting in the region, but I'd be just curious to hear about how have countries learned from one another's experiences that you've seen.
Right. So you've said it. CRO has had a lot of webinars, some of them on infodemics, on various aspects of infodemics, including community engagement. And the webinars have been designed so that you have a short talk relatively, but there's a lot of discussion. And that's led to countries learning a lot from each other. We've also shared, we're trying to document as much as possible what best practices from each country. Some of them also we've put up on our website, like community engagement in Thailand, for example. It's still a work in process, but that's a very critical and important point you've raised. And that's where I think our network is going to play a very important role, which we hope to move towards. And we really need to do that. And that's what I found very interesting about the different videos from all over the world, because there's a lot of commonalities between very different countries, but there's some that are unique as well. And if you watched, I don't know if Sahani's on this lecture, but if you watched her video on Sri Lanka, the way they went about it very systematically, I think there's quite a lot to learn from there as well. So I just shared my screen again. I don't know if can you see it?
No, please reshare it. Click the share.
Great.
Great. We see it now.
So I just thought I would summarize what I thought was some of the common parts in the infodemic in different countries. So we also a surge in misinformation with COVID that was amplified through social media. But we found that in most countries where there was trust built before the pandemic, it helped in addressing the issues. So a lot of work needs to be done well ahead. We also heard that uncertainty due to the evolving situation fed into the rumors. So dealing with uncertainty is one area that we need to get better at. How do we address uncertainty? Because the moment there is, and although, you know, it's tricky. So that's one area that we need to focus on, but that's something we've seen in most countries. Then there are a lot of common themes of misinformation: cures, stigma, anti-vaccine. We've also seen that listening is key. and proactive response from governments and credible sources. And social media is the way all rumors have been amplified, but almost all countries have responded, not just through social media, although social media played a very important part, but through multiple channels. They've also through radio, through television, as well as their networks. And it's essential to engage in most countries, from what we can gather, both online and offline. And engaging communities are key. You mentioned, if you look at the segment, the youth community, for example, you can define that as a community. You can define that different cultural groups, but it's each group has their own unique needs, and we need to, and their own beliefs, and we need to address it at their level, at the ground level. What's unique in different countries, from my take, as I said, I mean, all of you have your own take on it, and we've seen that in all the Slido messages. The ground situation in countries makes a difference. For example, we heard from the video in the Congo, there was a conflict situation, and that was unique. There was difficulty with vaccine uptake, not because so much as there wasn't a trust in the vaccine, as the fact that many people didn't believe they had Ebola in the first place. So why do you need a vaccine? So there were multiple issues there. Then the local socio-cultural beliefs make a big difference. You know, in India, for example, you've had rumors about eating meat because you have a large number of people who are vegetarian, and there is a bit of thing about meat anyway. So when rumors about eating meat causing COVID came up, it spread very fast. Then some people, I find that in some countries, many countries, they've partnered with fact checkers, and we've seen an increasing trend in that. Certainly in CRO countries, in smaller epidemics, we've had both seasonal flu epidemics, or we've had Nipah and other Zika. At that time, although we had fake news rumors, the partnership with fact checkers was not that advanced, but now increasingly most countries are doing so. Earlier, I think it was only Indonesia that had a website to bust fake news in this region, as far as I know. But now many others do. And so that's also something that many governments have taken up, and also partners, not just governments. But it's still not common across countries. Going to a particular place to check where the fake news is. Some countries have conducted regular surveys, but not all. So these are some of the things I've picked up between what's common and what's unique in countries. So we still have but there's a lot that we can learn from each other, and how we approach what the innovations are in the approach, both at the local level and in the digital media world. So moving ahead, and I've put this as a mountainous road because it's not going to be easy. It's going to be a long, curvy road, not a straight and easy road. And it's a mountain that we're going to have to climb. But we can do it. As long as we learn from each other, we strengthen listening and not just responding. And really, when I say listening, also trying to understand what's happening. And most of all, as you said in your messages on Slido, trust. It's a trust deficit that leads to an infodemic, and people not being sure, not understanding.